compulsory health insurance for senior citizens will pass just as surely as the sun will come up tomorrow. And behind it will come other federal programs that will invade every area of freedom as we have known it in this country, until we will awake to find that we have socialism.
It's called socialism.
Of socialism.
If you want to turn America into a socialist country, this is the first step.
The Democrats want to replace freedom with socialism.
For over 60 years now, Republicans have been desperately trying to take down Medicare. After failing to vote it down in 1965, Republicans have been relentless in their pursuit of dismantling Medicare, along with its parent bill, the Social Security Act of 1935.
Sunset programs like Medicare, Medicaid, and Social Security. Why would you propose something like that? It's not a Democratic talking point. It's in the plan.
In this video, we will focus specifically on Medicare and the GOP's most recently published plans for defunding Medicare, starting right away in 2025. Plans Republicans refuse to talk about in public unless they're at a private event with wealthy donors.
It will be my objective to phase out Social Security, to pull it up by the roots and get rid of Medicare. Medicare and Medicaid are of the same sort and need to be pulled up.
For more political content based on data and history, please subscribe. And if you think this content is important, please share. Thanks for your support. Despite what Republicans will tell you, Medicare is part of the foundation that created the most prosperous society in human history.
The new bill expands the 30-year-old Social Security program to provide hospital care.
Prior to the passage of Medicare in 1965, nearly half of Americans aged 65 plus didn't have access to health insurance, and anyone not born with wealth faced a difficult life after they were too old to work. Medicare became essential to the proliferation of the entire U.S. economy and the entire American way of life. Today, the largest generation has reached the age where they collect on the Medicare benefits they've paid into for so long. Add this to the fact that the U.S. healthcare system is the most unregulated and expensive in the world, and you are left with the conclusion that Medicare is underfunded and running out of cash, quickly. The Medicare Trust Fund is projected to be depleted by 2036. This would trigger automatic cuts of 11 to 13% from Medicare Part A. But that's not the worst of it. Because the Medicare Trust Fund only covers Medicare Part A, the rest of Medicare is funded with tax revenue from the General Fund, which is arguably in worse shape than the Trust Fund. The General Fund has been adding debt ever since the Republican Party decided they were going to stop taxing the wealthiest families after the Reagan Revolution of the 1980s. This is your daily reminder that our national debt is a tax revenue issue, not a spending issue. Bottom line, Medicare needs two things to continue to thrive. First, more funding from tax revenue, not from debt. A good example of this is in 2009 when Democrats passed the Affordable Care Act that enacted 2 additional Medicare taxes that only applied to high-income individuals, in addition to policy legislation that kept the Medicare Trust Fund from going bankrupt 10 years ago. And 2, Medicare needs government regulation that keeps healthcare costs low. A good example of this is in 2022 when Biden and the Democrats passed bills that capped the prices pharmaceutical companies could charge Medicare and ensured that these prices could not grow faster than the rate of inflation. But bills like this that keep Medicare fully funded only pass when Democrats have full control of Congress and the presidency. In fact, the only reason we have a fully funded Medicare program today is because Democrats controlled the government in 2010 and 2022. If Republicans take control of the government in 2025, they will cut funding from Medicare right away, in 2025, their first year in power. This is literally published in the Congressional Republicans 2025 Fiscal Budget. In fact, in the next 10 years, Republicans will cut more than $2.7 trillion from Medicare and Social Security. As terrible as that is, it was only 1 year earlier that the Congressional Republicans budget proposed cutting 50% of Medicare funding starting in 2032. a 50% cut to Medicare starting in 2032. Congressional Republicans will make these cuts to Medicare while at the same time voting to make the Trump tax cuts for the wealthiest Americans permanent. In addition, they will cut the 2 additional Medicare taxes on high-income individuals from the Obama administration that have sustained Medicare for the past 15 years. So, less funding from the richest of the rich and trillions of dollars in Medicare cuts. The Trump administration's Project 2025 transition plan illustrates how Republicans will move to privatize Medicare by making Medicare Advantage the default enrollment option in year 1. Medicare Advantage plans are offered from private health insurance companies that are less regulated to serve the public and built with a baked-in profit margin. This would be a major step in phasing out all Medicare plans not controlled by a private for-profit corporation. Republicans also say they will rescind any government regulation that protects beneficiaries from the for-profit corporations that have made the U.S. healthcare system by far the most expensive in the developed world. This includes all of the new protections from Obama's 2010 Affordable Care Act and Biden's 2022 Inflation Reduction Act. What does that mean? It means the ability for Medicare to negotiate drug prices, gone. The yearly cap on prescription drug costs, gone. $35 monthly cap on insulin and several other high-use drugs, gone. Using rebates to ensure Medicare drug prices cannot rise faster than the rate of inflation, gone. And protection for people with pre-existing conditions, gone. All of these laws protect Medicare beneficiaries and keep the program solvent by lowering healthcare costs. They would all be eliminated, causing the cost of Medicare to skyrocket. Question: will these published plans from Republicans impact the way you vote in 2025? Let me know in the comments.